Would you agree that from the information that you have heard throughout these days that heart disease is preventable? Well, the question is, can it be arrested and can it be reversed? Well, Dr. Hans Diehl is doing epidemiological studies and looking at the data to see if this is indeed so. So Hans, why don't you come tell us if this is possible? Dr. Hans Diehl.
It was the third night of a 16-evening program. And he was sitting there again, like this. And I knew exactly what that meant. And when break time came, I approached him and I said, Mr. Brenner, what brings you to the CHIP program? The CHIP program stands for Coronary Health Improvement Program. It's a program that spans 16 evenings, 4 weeks in length. And in this particular city, there were some 500 people enrolled in the program. I said, Mr. Brenner, what brings you to the CHIP program? He looked at me and he said, my wife. And that's the way it usually is. 2/3 of those who want to know more about health are usually women. And the men that come are usually dragged in by these women, which give you some idea about the good judgment of the genders. It was break time, and I saw his wife, and I said, Mrs. Brenner, I wonder, what brings you here to the CHIP program? And she said, my husband. And then she told me the story. And she said, my husband has had 9 coronaries. My husband has had 9 coronary artery disease problems. He said he's only 57 years of age and he's retired because of health reasons. 9 heart attacks, 2 bypass surgeries, and everything is clogged up again, and we don't know what to do. He has diabetes. He has all kinds of problems. We have gone everywhere to find help. We have been to the Mayo Clinic. We have been to the finest centers. My husband has diabetes for 5 years. He's 65 pounds overweight. He has a very high cholesterol level. He has high triglyceride levels. He has been hypertensive for 13 years. He also has gouty arthritis. He has a problem with smoking. Even after 9 heart attacks, he still smokes his pipe. She said he doesn't know how to lie down anymore at night because the angina pain is there all the time. Unstable angina pectoris. She said it has become so bad that we placed him into a lazy boy, a chair, a recliner, and he would sleep there. But after a couple of years, that no longer worked either. And now he's just roaming around day and night in this position because he can no longer lie down because of breathing problems. And we are at the end of our rope. She said, we have been to the Mayo Clinic. We've tried everything possible. He cannot even walk 50 feet to the mailbox without having to take care of some angina pain. And he has to take his nitroglycerins just to make it back to the house. We are just not sure what to do. He's taking all the medications that we possibly could find, prescribed by the finest physicians. He has 3 different pills for his, 3 different medications for his high blood pressure problems. He's taking Lopid for his high triglyceride levels. He's taking Coumadin to thin down his blood. He's taking 67 units of insulin. And we just don't know what we can do. And I thought maybe we can bring him here. Of course, she said, my husband is also a very heavy meat eater. I mean, he can put away a 2-pound roast in one session. And so when I saw him the next day, I had my work cut out. I said, Mr. Brenner, it's good to see you here again, like this. And I said, I understand that you had some heart attacks. Yep. I said, 9. Yep. And I said, I understand you also have some diabetes. Yep. I said, are you taking insulin? Yep. 67 units every day. I said, I understand you also have some high blood pressure. Yep. He said, I take 3 different medications to control this thing. And I said, I understand you also have some very high blood fat levels and high cholesterol. Yep, that's right. And then he looked at me and he said, what are you trying to do? Are you trying to change my lifestyle? Let me tell you something, he said. I'm a hunter, and I'm proud to be a hunter. I hunt exotic animals. I go up to the Arctic Circle. I go up to Canada. I hunt bear. I hunt caribou. And you come to my house sometime. I'm going to show you what a real man eats. He said, I'll show you my 5 freezers in the basement. They're filled with exotic meats. I looked at him, defiance written all over his face. And then I shifted gears and I said, Mr. Tell me, any dreams left? Oh, yeah. I said, what do you want to do in the next year? Oh, I want to go fishing. I said, fishing? Where do you want to go? Costa Rica. Costa Rica, Central America. Yep, I'm going to go there. I said, what do you want to catch? Marlins. Really? What weight? 80-pounders. I said, when? Within 12 months. I looked him squarely in the eye and I said, Mr. Brenner, you ain't going to Costa Rica in the next 12 months to catch 80-pound fishes. Whereupon he looked me squarely in the eye, and I could see utter defiance written all over his face, as if he was going to say, I am going to show you. And I knew it was time for me to exit. I'll tell you the rest of the story at the end, okay? So remind me, okay? We all recognize that heart disease is now taking every second life in North America, even though this disease did not exist 100 years ago. It was very difficult to find coronary artery disease 100 years ago. And while it is possible that we may have underestimated, perhaps, and underdiagnosed this disease, the facts are fairly clear. It was very rarely found in North America 100 years ago. It emerged after the 1920s and then blossomed, and today it is claiming every second life. And this disease is spreading like wildfire. In 1960, we found it in 10% of the world's population, 1980 in 20% of the world's population, and now we find it in 35% of the world's population at epidemic rates, and it usually is associated with the Western lifestyle. And the underlying problem, as you all know, is atherosclerosis. Narrowing and hardening of the arteries, the coronary arteries in this particular case when it comes to heart disease. What many people don't realize is that this is a disease that is not found in many countries around the world. It's only found in societies that have adopted the American way of life. The good life is really killing us. And what I want for you, what I want for America, is not the good life. No. I want the best life. And the best life is a simplified life that is chosen wisely and with intelligence, that moves towards a very simple diet with exercise and with putting more time and effort into building relationships, both horizontally and vertically. This disease process, atherosclerosis, is not something that happens when you're 70 years of age. It begins to develop when you're 15, 16, 17 years of age and when you are on an American dietary program. It is absolutely frightening to do autopsy studies and to see teenagers that combined drinking and driving and died. When you autopsy them, and we see already 20% narrowing of some of these very vital arteries in the system. Now, there are two different kinds of plaques that you need to be aware of. There are some plaques that develop gradually, as you see here, and they begin to take up 60, 70, 80% of the luminal space of the artery so that blood can no longer flow adequately. And this is then the time when you begin to develop angina pain because of inadequate oxygen delivery to the heart muscle. And then you can have a thrombus, a blood clot, and it is curtains for you. But this is only one kind of plaque. There's another kind of plaque that you see in the next graphic here, and that is a lesion. This is a plaque, again, filled with cholesterol and fat and calcium. But in this case, it is a plaque that is very small, 35%, 45%, 55%, often not even showing up on the angiogram, but nevertheless, these are very vulnerable plaques. They're young plaques. They are soft plaques. They're squishy plaques. They're filled with cholesterol, and these plaques can very easily fracture here, and then you have the same effect. This is what is causing 90% of all the heart attacks in America. The other arteries that get filled up gradually, slowly, up to 70, 80, 90%, these are the arteries that are involved and affected with angina. But the arteries that you see here, where the plaques grow fairly rapidly, where you have a lot of cholesterol inside, a lot of fat inside these small lesions, these small plaques, these are the dangerous ones. They can rupture. This is what happens when you sometimes have Olympic athletes. They're mean and lean, and they're just one body built for strength and efficiency. But if they don't take care of their diet, they can have 30, 40, 50% narrowing in some of these places, and suddenly they're keeling over, and you wonder what happened. Now, these are then plaques that lead to myocardial infarctions or to angina pectoris affecting the heart. If they affect the vessels to the brain, then you have a cerebral infarction or brain attack or a stroke. They can also cause hypertension. They're related to hearing loss, to visual losses, to senility, gangrene, impotence, and degenerative disc disease. It has to do with the circulatory system not being able to bring oxygenated, nutritionally rich blood to the various parts of the body, and they begin to deteriorate. We call them degenerative diseases. These diseases are characterized by fatty deposits in the artery, and they're neither natural nor a necessary component of aging. These plaques then can be found anywhere in the human system. And that includes the vessels to the brain and the intracerebral vessels. And I want to pause a moment here to follow up on a marvelous presentation earlier. And that has to do with the idea of how and where does God commune and communicate with us. Where, anatomically speaking, where does God reach us? Does God talk to us through our big toe? Does God talk to us through our pelvic bone? Does God reach us through our heart? Where does God commune with us? Through the mind, through our brain. There you have gray matter, white matter. You have this exquisite organ that is the ultimate computer based on electrobiological input and functionality. And within seconds, you can recall things that happened 35 years ago. You remember what it was like, the temperature, and you remember what it smelled like, the aroma in the air. You remember that very first kiss 35 years ago. And you call it in split seconds. It's all there. Marvelously and fearfully made. But what happens when the arteries that are supposed to bring oxygenated blood and nutrition to the brain, what happens? You begin to understand? You can have a deterioration. You can have a diminishment in the receptivity of the signal that comes. And doesn't God speak to us usually in a small, still voice, trying to get our attention? You now also begin to understand that if we can create this disease called atherosclerosis, which can affect our vessels to the brain and the intracerebral vessels, do you now begin to understand that how we choose to eat is not just a matter of lifestyle, just a different choice. No. It has a moral quality to it, doesn't it? Because it has to do with maintaining discernment in our brain for the special voice that calls and woos and says, I am at the door. I'm knocking. Is it possible that we drown out these voices because our cerebral vascular system can no longer bring appropriate blood, oxygen, and nutrients to the brain to keep it properly nurtured and in optimal condition? You see, here is a typical artery of a newborn in the brain. Very flexible. It expands with every beat of blood that comes through. But this is the very artery that you see there again in a 63-year-old man. It now looks corroded. It is brittle. It can break. It is as hard as petrified wood. And we understand now that this disease called atherosclerosis is related to certain risk factors, and we know what they are. It has to do with a high cholesterol level. It has to do with high blood pressure levels, with smoking, diabetes, obesity, triglycerides, and a lack of exercise, and stress. These are the factors that we can change. And please remember that no factor is more powerful in driving this disease called atherosclerosis than a cholesterol level above 160. And of course, if you have the other factors added to it, you can see that you can dramatically increase the chance of a heart attack. Here you notice that you have a person, a 35-year-old man, with a high cholesterol, high blood pressure, smoker, diabetic, and a treadmill test that didn't get passed. This person at 35 years of age has 140 times higher likelihood of a heart attack in the next 6 years when compared to a man who has ideal cholesterol of 150, ideal blood pressure, no smoking, no diabetes. You see, we can change these risk factors. They're under our control. And here again, you see the power of cholesterol. The higher the cholesterol, the greater the chance that you have high likelihood of lesions and high likelihood of a heart attack. We mentioned to you the other day that over 90% of our heart attacks could be eliminated if blood cholesterol levels would be maintained below 150 points. This is what we need to strive for. And yet we say to people, as a clinical fashion dictates today, just get it down to 200 and you're going to be fine. No. No. Once more, no. Because 25% of all the heart attacks in this country occur between 180 and 210. You don't want to have a 200 cholesterol level. So we can create these diseases. We know what these risk factors are, and these risk factors are determined by the richness of our diet more than anything else. Here you see a graphic that we discussed the other day. The higher the income in a society, the higher the likelihood of Western killer diseases. And we pointed out that the natural diet, the diet that God gave to man, that is still found in developing countries, is a diet that consists mostly of complex carbohydrate foods. These are the potatoes, the grains, the vegetables, the fruits. The grains, the potatoes, the starchy foods, unrefined. But as you can see there, when you have the income level of a society going up, something changes with the diet. And as you become more affluent in society, you no longer eat the oats and the soya beans, but you feed them to animals, and you eat the animals, and the animals are very high in fat and cholesterol and have no fiber. At the same time, you use perfectly good complex carbohydrate foods such as wheat, and you turn them into Twinkies, and you turn potatoes into Pringles. And with that, you increase dramatically the number of calories that you have in these products. Take a look at the animal kingdom here. You can see that when you have a sirloin steak, you're looking at a 75% fatty food. You're looking at bacon at 77%, and those spare ribs, 80% fat. And you look at the sausages, you look at that all-American sausage here, the all-American wiener, 85% of the calories is fat. And when you look at dairy products, similarly, you have high-fat products, especially milk is 50% fat, cheese is 70 to 80% fat, and cream cheese is even higher. And with these kind of high-fat diets, you now force the liver to go into overdrive and to produce excessive amount of cholesterol. And since cholesterol is only found in animal products on top of it, you now have an animal product which is high in saturated fat, which drives the liver to produce excess amount of cholesterol that goes into circulation, plus the meat that you eat has cholesterol of its own, so you add these two, and it has no fiber, which could have perhaps helped in the expulsion of cholesterol, and you are in trouble 3 times over. It was in the 1960s, after World War II, when we noticed a dramatic decline in heart disease in some of the Western European countries. After people had to live on very, very simple diets, heart disease basically disappeared. It was shortly after that time that people like Dr. William Connor said most population groups with a low rate of heart disease consume from 65 to 85% of their total calories in the form of complex carbohydrates derived from whole grains and tubers. This is the diet of choice. 65 to 85% from complex carbohydrate foods. And that was also the time when people like Nathan Pritikin emerged on the scene in the 1970s and said, we need to move towards a simpler diet the way we used to live and the way that simple developing countries are still living, because that's where you don't find this disease. We have to move towards a diet that has the original composition, a diet very high in starchy foods, and you will always get enough protein when you eat starchy foods. Well, Nathan Pritikin demonstrated very convincingly in his 4-week program, where he placed people on a basically vegetarian diet, very, very low in fat, salt, and sugar, and high in fiber. He demonstrated that he could lower cholesterol levels by 20 to 25 to 30% on the average within 30 days. Now, that may not mean very much to you, but let me tell you what that means in clinical terms. For every percent that you lower your cholesterol, you can lower the risk of a heart attack by 3 times the amount. So if Nathan Pritikin in 30 days could lower, in response to a diet and exercise program, the cholesterol levels by 25% times 3, that meant that he could reduce the likelihood of a heart attack in these people by 75%, and that is just changing the cholesterol. Powerful. Just as powerful as taking medications that are costly and where we have to worry about side effects. This was also the time when a man by the name of Caldwell Esselstyn, a gold medalist of the Yale rowing team for America, began to read the book by Nathan Pritikin, Live Longer Now. And he tells me the story. He said, Hans, I was on my way to Vancouver one time when I thought about my life. He said, here I was, a famous surgeon. I was considered among the top 10 thyroid surgeons in America. I was also very well respected as a breast cancer surgeon. He said I was involved in oncology. And as I was reading this book, and as I'm traveling at 30,000 feet above the clouds, it just struck me, what would they write on my tombstone someday? Here's a man, 49 years of age, in sort of a little midlife crisis. And he said to me, I mused about that, and I said to myself, they'd probably write, here lies Caldwell Esselstyn, who amputated 10,150 breasts. And he said, the thought was so absurd, I could no longer pursue my career. Even though I was a famous surgeon, I had to do something differently, he said. He said, I read this book, I finished the book, I came home to my wife and I said, we're going to change our diet, we're going to go towards a vegetarian lifestyle, and I'm going to check my cholesterol, I want to see if this thing really works. And he said, it worked. In 4 weeks, I took my cholesterol again, it was 155, and I went to my colleagues at the Cleveland Clinic, that's where they invented bypass surgery. Right? And I told them, I said, you don't have to do all these bypasses. You don't have to do all these surgeries. You can have more time with your family, with your friends. We can change heart disease. We can eliminate heart disease. We can reverse heart disease. You don't need all these fancy. And his surgical colleagues wondered whether he had taken leave of his senses. I mean, after all, over 50% of the revenue from the famous Cleveland Clinic comes from bypass surgery and angiography and angioplasty. Now, he was a well-thought-of man until that time. He was on the board of governors of the Cleveland Clinic, so he was a respected member of the scientific fraternity there. And as he began to talk to them, he said, look, if you don't want to do it, why don't you give me some of your patients and I'll do it myself? And they said, well, we're not so sure about these kind of ideas. Ultimately, he cornered some of his colleagues and he said, look, why don't you give me those that are inoperable? You can't do any surgery on those anyway. Why don't you turn over your inoperable cases and send them to me, and I see them every Friday and I work with them. And I'm going to see what I can do to change their lifestyle and to change their diet and to bring their cholesterol level down to 150, 160, and then we can maybe do angiography down the line and see if we were able to reverse the plaque buildup. Well, some of his colleagues, when they had inoperable cases, they would tell their patients, well, there's nothing really we can do anymore, but except you might want to see Dr. Esselstyn. He has some carrot program. Well, but because the people were very desperate, they came into his program, and he began the study. You see, Dr. Esselstyn had been very concerned. He said, most patients who undergo surgery don't have any fewer heart attacks, and they don't live any longer, and whatever benefits they have in reducing the pain, the angina, the benefits erode with time, and the procedures, these surgeries, are carrying a lot of risk. I mean, he said, let's look at this. We know that after bypass surgery, the chances that these grafted vessels close up on you within 1 year, the chances are 15 to 30%. You can have a graft shut down within 1 year. And that means you have to have more procedures, more surgeries. You have progressive disability, and obviously, you have not really prevented death. You probably don't even forestallen death. He said, furthermore, there are risks attached to this surgery. He said, angioplasties, we're doing 1 million surgeries a year. We're doing 1 million coronary bypasses a year, which means we are losing 240,000 people per 10 years from these two surgeries alone. He said, this is something we need to think about. On the other hand, he said, if you come into my program, I can guarantee you no pain, no surgical pain, no morbidity, no mortality from the procedure. People don't die from eating carrots, do they? And it doesn't cost you $50,000, $60,000. And the chances are that what we're going to do will last much longer than the intervention. Furthermore, Dr. Esselstyn said, it seems to me that the goal of cardiology has become the relief of pain and the relief of unpleasant symptoms in the face of progressive disability and often death from disease. We're not really affecting a cure here. We need to go beyond. And he said, we must shift the paradigm from interventional palliative cardiology to arrest and reversal therapy. We need to attack the causes. He said, we must go beyond simply treating the symptoms of heart disease, because even the best and costly high-tech treatment approaches have no effect on the incidence rates of this Western killer. We must attack the causes. In the meantime, a young cardiologist at Harvard, Dean Ornish, became aware of the Pritikin data. I was then the director of research and education there, and I saw these turnarounds. I saw people that had dramatic improvements in their angina pain. They would come sometimes with 50, 60, 70, 100 nitroglycerins a day just to make it through the day. And after 30 days, they would leave with 5 or 6 nitroglycerins. I saw the people within 2 weeks, the angina would disappear. And we said to ourselves, why? You cannot change these narrowed arteries because the plaques are oftentimes as hard as rock, like coral. This probably takes more time than 30 days, but what we began to understand was that you can change the thickness of the blood. Instead of having milky, creamy blood like molasses going through these narrowed vessels, you can thin down the blood within a week and 2 weeks. You lean out your diet, you lean out the thickness of your blood, and it can get through these narrowed arteries. And therefore, it can bring oxygen to the heart muscle, and therefore, the angina begins to disappear. We wanted desperately to demonstrate to the world at the Pritikin Longevity Center that this approach was reversing heart disease, but we couldn't do it because the technology was not in place yet. But it soon came. Dean Ornish got inspired by the Pritikin program, and he began to experiment, and he found resources, financial resources, and he found space-age technology that could now visualize the arteries, and he could now begin experiments to see, can you really reverse these plaques? Is it really wishful thinking, or is it real truth? Let me show you what happened. In 1990, Dean Ornish published his data, a 12-month clinical trial. What did he do? He took 20-some men and women that were scheduled for bypass surgery, and he said, I would like you to come into my program, and I will randomly allocate you either to a very strict dietary program, plus exercise, no smoking, or to a more usual care approach, namely the American Heart Association program, and we also tell you to stop smoking and to get into the exercise program. And here's what he found within 12 months. Take a look. Here you have 28 patients. And within 30 days, he began to see the cholesterol drop 20, 24, 26%, just like the Pritikin program had demonstrated. 24% drop in the cholesterol, and at the end of 1 year, on a vegetarian diet that was only 7% fat. The American diet is about 40% fat. Are you with me? So this was a radical departure from the high-fat, standard American diet. Standard American diet, short, SAD. Standard American diet. And when he looked at the angiograms, he found that 82% of the people had a regression. That means that the arteries, the plaques had begun to melt down, had begun to open up. And then he looked at the usual care control group. You see, this is now the group of 20 bypass patients that had been allocated to the usual care control group. They followed the American Heart Association, which gives you 30% fat, and you can have your meats and so on. And he found that on this kind of a program, the cholesterol only dropped 5%. And when he looked at the progression of the disease, he was shocked because in these patients, the disease, the plaques, had progressed in 53% of the patients. And Dr. Dean Ornish, at a scientific symposium, said, the American Heart Association's so-called prudent diet, which allows you 30% fat and up to 300 milligrams of cholesterol, may not be so prudent after all. It may actually promote heart disease. And of course, we have known for many, many years that there's no magic to this 30% fat recommendation by the Heart Association. It has absolutely nothing to do with scientific consensus. It only has to do with political and economic consensus. These are powerful lobby groups that are donating to the Heart Association. They're powerful factions, and they say, look, we cannot change so fast. Yes, maybe we ought to get down from the 40%. Let us settle for 30%. Yes, it may be true that we ought to get down to 10% or 20%, but this creates economic dislocations in our industry. We cannot do this. Let us go slowly at it. And so we have been at it for 30 years, recommending 30% fat. Here's Dr. Nestle. She said, she's a famous, well-known physician, highly respected, from New York State University. She said, the 30% fat guideline was never based on comparative or experimental scientific data. The evidence is overwhelming that it should be less than 20%. The Ornish Program, 7% fat. The Pritikin Program, 10% fat. The Atherosclerosis Program, 10% fat. No added free fats. And of course, the Ornish Program began to make waves in short order. They had well-designed studies done that involved many, many hospitals. They looked at one-year results. And here you can see that in this large trial with 507 coronary patients, they found that 65% of the patients no longer had angina. It was gone, no more. Studied for 1 year, no more angina. 65%, no more angina. Plaque progression was stopped. Plaques began to reverse in 65% of the cases. And of course, when this became well known to the insurance industry, they said, look, we can save money by sending people to the Ornish Program, which is going to teach them to follow a very simple vegetarian, very low-fat diet. We don't have to have all these bypasses. We're going to save money. And here's the first data that shows that the industry, the insurance industry, saved $10,000 per person sent to the Ornish Program. And then in 1998, 99, Ornish again is now making the front cover of Newsweek. Here you can see it says, "Can this man save your heart?" Shaking up the American medicine establishment, Dr. Dean Ornish. Of course, he had now been nominated for the Nobel Prize in demonstrating the reversibility of coronary artery disease by using a very simple vegetarian, very low-fat natural food diet program. Newsweek said, 1998, Ornish has scientifically proven that people can open their blocked arteries without drugs or surgery. Instead of splitting people's torsos to replumb their hearts, he guides them through a rigorous lifestyle program. Amazing, isn't it? The simplicity, the efficacy, the economic viability. Just think what we could do if we had the national will and if we had access to the media and to reach through the media the people in this country and let them know what they can do. Many people would do just that. I believe that the American people are smart enough, once they recognize that it will work, they will do it. Many of them will. Well, what is the Ornish Program like? Of course, you have a very simple vegetarian diet, 7% fat, very little sugar, lots of fiber. You have a daily exercise, half an hour. It also emphasizes 1 hour meditation, stress management, and it includes group support. Ornish. The demonstration that a very simple lifestyle change can arrest America's #1 killer and reverse it and enable people to get off their medications and in 2 out of 3 cases being freed from any angina pain. Unbelievable. Do you remember Dr. Esselstyn, the oncology surgeon, the surgeon that was famous for thyroid surgery? Remember, he was reading this book. Well, in the meantime now, Dr. Esselstyn had progressed in his study, and I want to give you the results here. Here you see him. He presented his data at a national conference sponsored by the Cleveland Clinic. And there you see, he had 24 coronary patients. These were the patients that were supposed to be seen for bypass surgery, but they were inoperable, and so they were sent to Dr. Esselstyn's vegetarian program. 24 patients, 4 of them basically said, no, I can't do it, it's too hard of a program, so we ended up with 18 coronary patients. Please note, these 18 coronary patients were seen at the famous Cleveland Clinic at the cardiology department there during 1977 to 1985, and during those 8 years, these 18 coronary patients suffered 49 cardiovascular events. You see, just because you're at the Cleveland Clinic doesn't mean that you don't have a heart attack or a stroke or you need to have some angioplasty. So there were 49 cardiovascular events during that time, during those 8 years. But please also note, the cholesterol level on the average during those 8 years for those patients was kept at 237. Is that a high risk? What should it be? Yeah, you're a great class. It should be 160. But in those days, we thought 237 was just fine, just average. And so these 18 coronary patients have 49 cardiovascular events in 8 years. And then they come into the dietary program of Dr. Esselstyn, and he begins to take record, inventory of the first 5 years. And please note, in the first 5 years of his study, you see, these patients did not suffer one cardiovascular event. Remember, as you get older and you already have heart disease, you will have more and more cardiovascular events. These people had how many in 8 years? 49. They should have at least in the next 5 years had 30, 40 or so. But instead they had 0 cardiovascular event. The cholesterol was also kept below 140. And the disease was arrested in every case, and the regression was documented in every case. Simple diet. He didn't even talk about exercise or some of these things. He just wanted to see if diet could do it. And there you have the documentation. There you see a coronary artery that is narrowed. You cannot see the blood flow as well as it should be. But within 2 years, you can see the full blood flowing again, which demonstrates a 30% regression or melting down of these plaques by 30%, allowing blood to flow more fully to the myocardium, to the heart muscle. So Dr. Esselstyn said, what we need to do is give patients a cholesterol-free, that's just another word for vegetarian. Are you with me? Sometimes we use the word a plant-based diet, especially when we work in the beef belt of America. We call this a cholesterol-free diet. It is really a vegetarian diet, 10% fat, and sometimes he gave them some medication to bring the cholesterol down even further. He said it resulted in angiographically documented arrest and regression of coronary artery disease. Now, this wasn't all. You see, Esselstyn had done his 5-year study, but he kept these people in the program, and they didn't want to change. They said, Dr. Esselstyn, we know that if we go back to our diet, we will have angina again. We enjoy this lifestyle. We enjoy this food. And we're saving money. And we're feeling great. And so he followed them up now for the next 12 years, and here you see the results. 12 years and 12 years, not one cardiovascular event, not one bypass surgery, not one angioplasty surgery, not one patient with disease progression. Unbelievable. There is no stronger data in the world today of science that says very clearly you can reverse coronary artery disease. Ornish has shown it. Esselstyn has shown it. Pritikin probably led the way, but he never had the chance to see the actual results documented with space-age technology. Remember I said to you there were 24 patients to start with, right? And 6 dropped out. What happened to those 6 dropouts? You notice here these 18 patients who stayed with the program, they had 0 cardiovascular events in 12 years, but the 6 who dropped out within the first 18 months, these 6 patients had 13 cardiovascular events in the next 12 years. The way you live, the way you choose to eat, has a powerful effect on how long you live and the kind of diseases that you will have. Dr. Castelli, the man from the famous Framingham study, said to me, he said, Hans, I'm not really all surprised to see the reversal of heart disease. I mean, he said, we have known this for years because we have done this with animal studies. I mean, if you want to produce a heart attack in a monkey, all you have to do is give them a typical average diet of a hospital. And these monkeys will die within less than 2 years of massive heart attacks. And Dr. Castelli said, Hans, we know how to produce these plaques. We know how to create heart attacks in monkeys. We also know how to reverse coronary artery disease in these monkeys. All we have to do is feed them a simple, low-fat vegetarian diet. And then he added, the trouble is in Western society, you have to be a monkey to get the proper dietary treatment for heart disease. He said, it's not the Heart Association diet. We got to go beyond. We got to go to a very simple diet and leave out all the cholesterol. That means a vegetarian diet, but we also have to be careful about the other factors such as the sugars and the fats and the oils and the grease. A simple diet, foods as grown. You cannot improve on the design of the master designer. What do you say? Let me give you some other, perhaps a little guideline that I have picked up on. Have you ever noticed that when you buy man-made food, they always have nutritional labels on them? God doesn't need to have a nutritional label to tell us that His food is okay. And so we have to recognize, while scientists are very clear that coronary artery disease and atherosclerosis affecting our arteries to the brain, inside the brain, towards our ears and eyes, to the penile arteries. These plaques are reversible. They can melt down. But most people, just like this lady here, don't know. And they say, oh, but no one ever told me that dietary change could turn things around. We have an awareness problem. We have a communication problem. We have a problem of getting the word out to the people, don't we? And that's why we have a 40-hour education program that enrolls 500 to 1,000 people at a time to reach a critical mass in towns that I will tell you about tomorrow. You'll be thrilled to see what can happen. And I would like to challenge you to take a closer look at the opportunities that are out there in becoming involved in helping people, helping themselves. And thus find the greatest joy that you will ever find in life. There's no greater joy than to be able to help someone else to see the light, and they say, aha! And you don't control, and you don't manipulate, and you don't create guilt. No, you just try to open up the scenery so they can see. You begin to open up the curtains, and they can see, and they become autonomous people. You give them some things to read and some videos to watch and some tapes to listen to and some books to read and say, oh. And they evolve in front of your very eyes. What a joy it is to see people that are no longer dependent on a medical care system to the extent that they are, because the system largely treats only the symptoms. It creates dependency. When we could create freedom, autonomy, and the joy of victory, of achievement. You see, the Surgeon General said for some time now that one personal choice seems to influence long-term health prospects more than any other, and that is what we eat. Then why don't we do it? The National Cancer Institute has recommended at least 5 fruits and vegetables a day. It is the order of the day. That's a minimum. And then, lately, the American Institute for Cancer Research, I was just at a meeting with 15,000 cancer scientists in the Moscone Center in San Francisco. And here's what they say. They say in preparation of a major policy report, an expert panel reviewed 247 studies on the link between vegetables and fruits and cancer prevention. Is there a linkage between fruits and vegetables consumption and the incidence of certain cancers? And the answer came back. The expert panel said, plant-based diets, vegetarian diets, showed cancer risk reduction in 78% of these studies. What do you think? What do you say? Yes. Then, the American Institute for Cancer Research announced new guidelines. This was just last year, for eating, which reverses the traditional American plate. What is the American plate like? You have a plate, you have in the center a big steak, or you have some kind of a fish, or you have some chicken, you have some nondescript, dark-looking blob. And that's what people are willing to die for. And the American Institute for Cancer Research says, we have to change the American plate. Meat is now treated as a side dish or a condiment. What does that mean? A condiment, you can hardly see it, right? A condiment is some additive. It's something that you add in very small amounts. They say, if anything, the meat should be on the side of the plate. And I always tell people, I'm usually a gradualist. I try to be progressive. You cannot push people too fast, too hard. And so I come across soft and gentle, but with strong data. And I say to people, I said, you don't want to have that big steak take the center of your plate. You want to have color there, gorgeous colors. You want to put that meat on the side, at the edge, and if it falls over the edge, it's even better for you. Do you remember the story of Mr. Brenner? Oh, he looked me in the eyes with defiance, and I knew it was time for me to exit quickly. After all, he was a hunter of exotic animals, and I didn't want to be the next one. I come to Kalamazoo. We have 4,000 people that have graduated from the CHIP program. I'm coming for an alumni meeting. I'm flying into Michigan. And as I come to town, the newspapers pick it up somehow, and I get a phone call at the hotel, and it's Mrs. Brenner, and she says, Dr. Diehl, I know you're in town. I know you're going to have an alumni meeting tomorrow. Would you do me a favor? Would you feature my husband, Mr. Brenner, the hunter? 5 freezers full of exotic meats? She said, I know. You don't feel comfortable, do you? I said, not really. She said, he's counting on it. I mean, my husband has everything on cue cards. He figures you will give him 8 minutes. He has an 8-minute speech prepared. He has rehearsed it, and it's good. You can trust me. Do it. It's best medicine for my husband. I said, Mrs. Brenner, I want to serve you. I want to help you. I want to help your husband, but I'm concerned about hundreds and hundreds of alumni, and I'm not so sure what your husband is going to say. Can I first see the speech? She said, no, well, I don't know. She said, I'm a school teacher. Believe me, I've gone over every line, and I believe in this program, and believe me, it will make you look good. Well, when somebody says that, what do you think you do? Yeah, you say, fine. So, next night, I introduced Mr. Brenner, but with some detachment. I wanted to be neutral. I didn't quite know what to expect. And then Mr. Brenner gets up there. Remember, he is the man that said to me, are you trying to change me? You cannot change a German. And I remember when he said that to me because I thought to myself, yeah, I know these people very well. I've lived with them for 20 years in Germany. I know these people. And now Mr. Brenner gets up. I introduce him briefly. He gets up. He takes the podium and he said, ladies and gentlemen, you know the word American, the last 4 letters are the most important. And if you're an American, you can. Because he said, I can. I'm a German and I can. He said, I came into this program and this man defied me. He said to me, you're never going to get to Costa Rica. You ain't going to go to Costa Rica in the next 12 months. And at that moment, I swore to myself, I'm going to show this man, this arrogant man, I'm going to do everything that he says to the T, and I'm going to see if this thing really works. Whew. He said, I've done everything he said because I wanted to prove him wrong. Then he said, and here are my results. He said, my angina markedly decreased very quickly. I was able to level off my bed and remove the recliner from my bedroom. He said, furthermore, I lost weight. I would eat more food than ever before, and I would lose weight. Just like he said. It went from 221 down to 208 in 3 months. My blood sugar went down from 206 to 131, and I had to reduce my insulin. You can change your diabetes. Any American can. I can, you can. Oh, I said, keep on, preacher. He said, my cholesterol was 290. Now it's 111. I'm off the medication. My triglycerides were 2,000 plus. Now they're down to 500. And my blood pressure, I'm off all 3 medications, and they're normal. And my pulse is down. I'm exercising. I'm walking. I can sleep at night. I'm a new man. 3 months, it changed my life. I didn't check my watch. He could talk all night long. It was fine with me. And then he said, do you remember I had those 5 freezers of exotic meat in my basement? He said, as a result of this program and the changes I made, I became best friends with my neighbor's German Shepherd dog. He said, of course, the dog has died since then, but no. You see, dogs can handle cholesterol. Humans cannot very effectively. And I tell you, he was a new man. And then I said to him, you see, when a person has achieved something, as a leader, you create a vision. And you say, and what are you going to do next? And he said to me, remember, 6 months, 12 months, I said to you, 12 months, I'm going to be in Costa Rica, I'm going to fishing. I said, I believe you can do it. He said, I will let you know. 6 months later. And he sends these pictures to me, and he says, they're 80 pounds and 90 pounds heavy. And I asked some fisherman, I said, is this really true? Is this just spinning a yarn? He said, no, this is about an 80-pound fish. And so when I saw him the next time, after he had returned from Costa Rica a year later, I had him on the podium. Of course, it was easy to make a decision to have him at my CHIP meeting. I wanted him now. And I said, tell me, what happened in Costa Rica? And he talked about those 3 big fishes. And he showed those pictures. And I said, tell me, didn't you have angina? I mean, in the early days, before the CHIP program, before the lifestyle change, just the nibbling on the hook would give these people an angina attack. It is. And now you got an 80-pounders on the line. Oh, he said, I wrestled with that fish for 4 or 5 hours. I said, angina? No. I said, what about the second fish? Well, some. What about the third fish? Well, I had a hard time getting him in because I was now losing my energy. The energy was draining from me, and I had some angina pain. But I got this fish into the boat. I said, what'd you do with all these fish? He looked at me, and addressing 500 people, he said, I'm now a vegetarian. I let it go. And so it is. Heart disease, it's totally preventable. Heart disease, in most cases, it is arrestable. And in most cases, it is reversible. All you have to do is be willing to make some simple lifestyle changes and to say yes to life. Thank you.
Hi, I'm Charmaine Vieira. I am standing here in front of Bella Vita Lifestyle Center. Through these doors, many suffering spiritually, mentally, and physically find relief and are filled with gratitude as God works on their heart. Great light has been given to God's church on health reform. As the right arm of the third angel's message, God's methods of treating disease will open doors for the entrance of present truth to prepare souls for the soon coming of Jesus Christ. Here at Modern Manna, we have successfully led the way in a cleansing and detoxifying program that not only touches the body, but also reaches to soul and spirit. We have found that Christ's method of ministry brings true healing. In Volume 7 of the Testimonies, page 62, we are told, we have come to a time when every member of the church should take hold of the medical missionary work. RISEN, an acronym for our Remedial and Integrated School of Evangelism and Naturopathy, will empower you to answer the call to medical missionary work. Our program is based on the natural hygiene blueprint of the early pioneers, incorporating the 8 laws of health, cleansing, and detoxification. Learn how you can live optimally and coach people to healing from the diseases of lifestyle. Graduates of our Natural Hygiene Coach certification come from all around the world. They are motivated, resourceful, dedicated, and are making a difference through opening their own lifestyle education homes, coaching individuals, working within their local churches and communities, and broadening workplace wellness opportunities. Don't miss out on our upcoming 14-day Natural Hygiene Coach certification program. To find out how you can be involved with this amazing movement, visit us at www.modernmanna.org and click on RISEN to register for the Fundamentals of Natural Hygiene. This online instruction is a prerequisite course that prepares you to successfully complete the Natural Hygiene Coach certification. Jesus says in Luke 10, verse 2, "The laborers are few. Now is the time to join us. He is waiting."